Nurse May, first and foremost, kamusta po kayo ngayon dyan sa UK?
It's okay naman po. Medyo nag-yellow at the moment. It's the first snow day for the year of 2021. And yeah, so for me, I'm on days off. Wala kaming kasama sa bahay, so we have to do all the cleaning, all the chores and things. Pero okay naman, medyo pagod, pero that's the part of the job, and not having the extra help. Hindi tulad sa Pilipinas, may mga pwedeng tumulong, dito wala.
Nga po, ito Nurse May, no, a month ago, you made a historic feat, not just for the UK, but for the whole world. And you made us all proud. Nurse May, take us back to that moment. Anong pakiramdam na kayo yung nag-administer ng first approved vaccine sa buong mundo?
Right, so that time, medyo kabado ako, syempre, kasi they told me about the vaccine, that we're rolling it out, na we've been given the information about the vaccine, at saka kung ano yung pwede namin sabihin sa mga pasyente. We are guided by our own Public Health England, obviously. Pero for me, at that point, I was only more worried or more kind of focused kay Maggie and all the others that were having it that day. Kasi nga, syempre, kahit na there's so much things going on with the vaccine, there's so many questions. So, sa akin, ang focus ko is for Maggie, to make sure na okay siya, na komportable siya, at saka alam niya na actually ito yung una. So, at that time, hindi ko talaga inakala na ganun kadami yung media. I was more worried about her. Kasi nga, for me, I'm doing the vaccinations for a few years now, and I have a lot of experience kapag ka nag-injection. So I wasn't too worried about myself. I was more worried about her. Kasi nga, syempre, the mantra for nurses is your patient go at the top of your priorities, which is what she is. So kabado, nag-aalala ako for her. I think it's only afterwards na naisip ko na, oh my God, what if kung nadapa ako? You know, mga ganun. So it wasn't until after. Yeah. And it also made me realize na actually, ang daming Pilipino sa ospital namin. And I think I wanted to take them with me at that historic moment to actually share with them the pride that I have in terms of what we contribute to society. Na even though we are nurses na from another country or anywhere else really, we can make a difference to people's lives. Kahit hindi siya ma-televise, hindi siya madyaryo, I would like everyone to know na the first-hand care na binibigay nila sa mga pasyente, it has a positive contribution to, syempre, kung ikaw ma-hospital ka, you would like your nurse, or you have whoever's looking after you to give you the best that they can. And I think it's almost kind of like ripples in the water. So if you put stone in it, it ripples. So for me, I just wanted everyone to feel like they are making the difference. Kasi nga, syempre, we're exposed at the moment with the pandemic. There's a lot of things that we don't know about the virus to start with. And we're all kind of like, I personally felt like I was going into a war where we don't even know what we will do to kind of win it. So I just wanted to share that historic moment with everyone, with nurses, healthcare workers that are putting their lives at risk, putting their families' lives at risk. And I wanted them to feel that we are valued, that we can make a difference. Kahit na hindi siya laging nasa TV, hindi siya, it doesn't gain that popularity or anything. We have that duty of care to our patients to give our best. So yeah, I think for that moment, I was only worried about her, and I wasn't worried about me. And I think at the end of the day, we try to give the best that we can for the patient, really.
Yeah, that says a lot, Nurse May, because you're thinking of your patient, you're not thinking of yourself, and that says a lot as a nurse. Nurse May, Paano kayo napili ng hospital ninyo to administer the first approved vaccine doon kay Maggie?
So basically, sa taon-taon during the winter, we have a program called peer vaccinator program. So basically, ang nangyayari doon is yung mga nurses or allied health professionals, they get the training to give the flu vaccine to our staff. Now, in my trust, in my hospital that I work in, there's about 9,000 people there. And what we do is our occupational health department, they train the nurses to deliver the vaccine to our colleagues. So say, for example, I work in ward, whatever. If I sign up to be that peer vaccinator, my colleagues that works with me will come to me and say, May, I want the flu vaccine. Can you give it to me? And I will say, yeah, I will give it to you. So that's what I signed up for. For 3 years running, I've had the record of highest peer vaccinator numbers. Kasi for me, when I get the job, so for example, sinabi sa'yo na, oh, ito, this is your job, this is your contribution to the peer vaccinating program, I really take it to heart. I'm really passionate about vaccinating people against flu, because at the minute, even before COVID happened, there was a lot of people that gets hospitalized and actually die of influenza. So for me, if I vaccinate my staff or my colleagues, it means that they're being protected from the flu. And then that if they don't get the flu themselves, they don't pass it on to their patients who are more likely to be very at risk naman anyway already, kasi nga, syempre, may sakit sila and then they go to the hospital, and if you imagine, may sakit ka na, tapos magkaroon ka pa ng trangkaso, syempre, it all adds up to the mortality. Tapos, this year, I did 140 vaccinations in one day.
Wow!
So, kahit gaano ako ka-busy, I make sure that I make the time, kasi nga, I know it protects my staff. And what I did was I went to the wards, so where the people are working, I took my trolley, I went to them. At the minute, pagka kunyari gusto mo ng vaccine, you have to schedule an appointment, you have to go to this department, you have to be out of your area. For me, it's important na kung wala silang time, masyado silang busy, then I would come to them and I'll give them the vaccine myself where they work. That means then they don't have to be out of the area that they're working in. And it's easier for them to continue what they're doing in the wards. And then I just go to them and give them the vaccine. So that's why. The director of our occupational health has recognized that I was very passionate about it and that I was, doing a good job and I was thinking about the staff welfare. And so she put my name forward kasi nga, alam niya kung gaano ako passionate with vaccination.
Wow. Pero nurse, nung binanggit at sinabi sa inyo yon, alam nyo na yung i-administer ninyo ay yung first ever approved COVID-19 vaccine.
Yes.
Okay. After
Kasi,
nun, okay, go on.
Kasi even before that, I was part of the group. We have a group in our trust where they were checking about the logistics of the vaccination, really. So kumbaga, with training wise, what do we need to do with the clinic? What do we need to be putting in there? So I was part of that group. I was part of the planning, pero not the whole of it. From nursing perspective and from a peer vaccinator perspective, I was part of the group when they were planning about the rollout in my trust.